Okay, earlier this month, the FDA approved the medication Zuranolone for the treatment of postpartum depression. This is making it the first FDA-approved pill in the United States, specifically for postpartum. The treatment has been approved as a once-daily pill that is taken over the course of 14 days. And to explain more about the impacts of this pill and what this means, we have our parenting expert, Dr. Cheryl Ziegler, with us. First of all, postpartum, it's something that we cannot talk about enough, because every time we do a story on it, we are flooded with emails, people saying, please do more, tell us more, it's serious.
Yes, and it's even considered underreported and underdiagnosed, right? It takes a lot, there's a lot of stigma and shame in those first weeks or months after you have your baby. Everything's supposed to be so great to say, I don't feel great, and I'm having, concerning thoughts, or I'm depressed, I'm not bonding with my baby. Those are some of those symptoms that we're looking for. Somewhere in there, the mother knows, I'm not really bonding with my baby, but that's so hard to say to even one person.
This is something, though, that I don't think was on the table. So this discussion now, having it out in the open, I hope creates a lot more daylight for women and for families that are struggling with it, to talk about it, seek help, whatever form that may take, because I don't think this is something that was talked about all that freely even 5, 10, 15 years ago.
Oh, absolutely not. Definitely, you go past even 5 years. No, it really wasn't. And one of the things that I'll say about it is, by having a medication, it's validating. Like, oh, this is real. This is so real that it's been studied and that the FDA has approved it. Just that in and of itself sort of says, I'm not alone. There must be many other people, right? They don't make medications for just a few tiny people. So I hope that that's one piece. I think the other piece that hopefully can be motivating is that for women to remember that this is a very clinical condition. This isn't a mindset. This isn't, oh, I'm wanting this or I think this way. And that now there's partial treatment, right? I consider medication, and this is the stance of psychologists, that's part of the treatment. We still want women to hear, go to psychotherapy though. Make sure that if you're on medication, and it applies to this med and others, you also still want to be checking in with somebody, really talking about these things, because this medication was studied on people who had more of the severe postpartum depression.
We talk about that complete aspect. Would a therapist have to prescribe this in the first place?
So usually, like a psychotherapist, psychologists don't have prescription privileges. Right. So we would do more of the talking and the action plan, maybe creating the support system. We would talk about what's happening, and the medication is just something that you take, right? So you're gonna hope that it is effective, but you really want to be meeting with somebody who's a professional in this space to be talking about what are you thinking, are you feeling, and also monitoring, hey, you are getting better. We are seeing results. Or maybe 2 to 3 weeks later, I don't know if we're seeing any results. Let's come up with another plan. You really need that person.
So yeah, they talk about taking it for 2 weeks. And I think people say that, to be honest, moms, the first year or two, you're so tired that it's easy to cry at the drop of a hat. I mean, you can feel all kinds of feelings, and it goes from the baby blues to something much more serious where you are having thoughts that aren't right. What are the first signs like you should call somebody? I mean, is it right away when you're in early stages, like I'm struggling?
Yes, right away. And here's why. We know that that postpartum depression is really the second leading cause of mortality in women after they have babies. And so taking their own lives, possibly hurting the baby, that's definitely on the severe end. But they may have thoughts that lead up to that if you're talking to somebody, and again, this is going to probably be one person in their lives because people don't feel comfortable saying these things. It might be a professional, it might be a friend, it might be a parent. But yes, say, even if somebody had a baby, I feel this way. I feel like I don't always want to hold my baby. I don't want to come to them when they're crying. I don't want to get out of bed. It's that. It's not the, oh, I feel so tearful. You can be hysterical crying and still say, no, give me my baby back. I want to hold them. There really is a connection which is so disturbing to moms, where they maybe don't want to tend to their baby in the ways that they imagined that they would have.
What do you think makes this drug, this treatment specific to postpartum depression and not just an anti-anxiety medication?
Yeah, so what I know from it is that they have tried doing typical antidepressants for women with postpartum, and they just have been completely ineffective. So what I know is that it's also going on some other neurotransmitters like GABA. They are kind of tapping into other neurotransmitters that there's an anxiety component to it. So there's depression and there's anxiety, but with postpartum depression, it can almost feel like you're having both. You're very nervous, you're unsettled, you have ruminating thoughts. So ruminating thoughts mean like circling thoughts that you can't quite stop. And then there's that lack of motivation, and then paired with this incredible loneliness of nobody really knows how I feel. And if they did, what would they think of me? So I just know that it is different from a regular antidepressant.
Right.
And I actually want to say that because maybe some women have tried that. Maybe they say, oh, I've tried something, it didn't work. Well, this is supposed to be different.
Well, we'll continue to talk about it, and we certainly will be looking at what this drug is doing and how it's affecting many women these days. It's always good to talk to you about everything, but this in particular. Thank you, as always, Dr. Cheryl Ziegler.